HSJ Provider Summit brings together the leaders from the providing organisations in the NHS, acute trusts, mental health and community trusts, together with senior people from national bodies such as NHS England and the Care Quality Commission. The NHS faces a really tough challenge in 24-25. It's an election year and money is as tight as it's ever been. It's really important to give the leaders the opportunity to talk amongst themselves, to tackle these issues head on, to identify best practice and to make plans for the future.
I've always found the HSJ Provider Summit a really useful place to share ideas with colleagues, to hear a bit about what's going on in other parts of the country, and in the kind of environment where you can properly explore it, test ideas and share thoughts, rather than just one where lots of information is being delivered to you.
We've had very interesting sessions around the urgent and emergency care pathways. The important bit is not to forget our children, because we are seeing a significant waiting list in our children in both the admitted and non-admitted pathways. We have kids now waiting for neurodevelopment assessments, your autism and ADHD, and that's about a 3-year waiting list. They really need the care they need, and if you don't sort that out, it will have a long-term impact on their whole development.
My session theme was about maintaining financial balance whilst not compromising quality of care. This is a system challenge, it's a national challenge, but how do we interact with our integrated care board to really have the benefits for our residents and communities?
The operating environment is challenging. We're still recovering from COVID, we've got industrial action, we've got growing demand and inflationary pressures. Noting all of that, the NHS is making sustained improvement, but we've got more to do.
I spoke about the importance of how to create safe and trusted environments for innovation and collaboration. And the second panel was the future of workforce EDI. And I talked a bit about the importance for us to look beyond the wealth of data that we have to real practical applications that make a difference for patients and our staff.
I was part of a session all about learning from the last winter and our experience of rolling out electronic bed and capacity management and a hospital care coordination centre with our partners from teletracking.
The panel was about the contribution of digital technology to patient safety. Scanning technology can enhance safety if it's applied effectively, so it can help drive productivity and efficiency of the services as well. So there are multiple benefits from introducing it.
HSJ create a space that just gives us time to breathe. It's a really good opportunity to be ambassadors for what we're saying.
When they talk about Black and Asian communities being hard to reach, we're not hard to reach. The people that are hard to reach are chief execs, chairs and board directors. So to come to a conference like that, it makes it easy access.
You will definitely hear something that someone is doing in a different way that you can take away and think, is that something I could explore for my own organisation?
My day-to-day job is so busy that being able to have time to lift my head and connect with others is so valuable.